The pandemic may be over. However, a familiar and controversial pandemic-era mandate is making a return in some states. I'm talking about mask mandates. Hospitals in a handful of states are requiring staff to wear masks. The shift comes with a rise in JN1 variant infections. Hospitals in California, Illinois, Massachusetts, New York, and Washington, D.C. have all brought back the requirement for selected people in medical settings. The reason, the CDC reports, is 10.4% increase in COVID hospitalizations in the week leading up to December 16th. Data also shows a 3.4% increase in deaths. The agency reports the new variant accounted for 44% of infections nationwide by mid-December, up from 7% in late November. Mask mandates have been controversial since the day they were first implemented. Beginning in early 2020, medical professionals and the CDC advocated for mask wearing in everyday life, from grocery stores to airplanes to religious services. As the pandemic waned, so did the mandates. But now, Massachusetts' largest health system, Mass General Brigham, said effective Tuesday, January 2nd, masks will be mandated. The hospital said they are necessary until respiratory illnesses decline. The rule is put into place when these illnesses go beyond 2.85% of patients coming to the hospital or outpatient clinics with symptoms of a respiratory illness for 2 consecutive weeks. It's lifted once the number falls for a week. The hospital strongly recommends patients and visitors wear masks. Staff in hallways and common areas are exempt. Some medical facilities took action even earlier. The Dana-Farber Cancer Institute in Boston began requiring masks for patients and staff on December 18th. The hospital says the policy will be in place for the foreseeable future, and there's no gauge for when to rescind the mandate. However, the hospitals implementing these policies remain in the minority. Most hospitals eased or eliminated masking requirements last spring. It begs the question, what is the PPE supply situation in these states? An investigative report by the Associated Press found at least 15 states, from Alaska to Vermont, tossed out PPE because of expiration, surpluses, and people unwilling to use them. They trashed more than 18 million masks, 22 million gowns, 500,000 gloves, and more. Rhode Island said they tossed or recycled more than 829 tons of PPE. Maryland got rid of more than $93 million in supplies. In 2020, states spent more than $7 billion in a few months on PPE, ventilators, and some other high-demand medical devices. The federal government paid for many of the supplies. Now, with larger surges of COVID-19 over, expiration dates are passing, and there are fewer requests to tap into the stockpile. Dr. Georges Benjamin, executive director of the American Public Health Association, said, "What a real waste. That's what happens when you don't prepare. When you have a bust and boom public health system. It shows we really have to do a better job of managing our stockpiles." While mask requirements go into place at some hospitals, the states seeing the largest increase in COVID-19 are steering clear of any mandates in hospitals like Nebraska, Iowa, Kansas, and Missouri. These states have seen an 18.3% of positive cases in the week leading up to December 23rd.